Sorry, it's been about a week or so here since we've been wanting to do the new one of these, but trying to start catching them up a little bit more now that we've got the stuff in there for that second exam. So the next thing we're going to be looking at in our next test is really going to be looking at articulations as well as the muscles. So with articulations, we're really talking about the different joints, and to me this is a rather quick chapter. We're really looking at some of the different ways we classify these and some of the basic structures within these. Again, these are the lever systems that are allowing the muscles to pull on those bones. This is where the fulcrum is going to be that allows those different types of movements to take place. So really a joint is something that's connected by two bones, and like I said, a lot of times we're classifying these based on either how they're built or what they do. So one of the ways we can classify joints is based on degree of movement. These are kind of fun sciencey words here, but we can have what are called diarthrotic joints or diarthroses. These are freely movable joints. So these are the ones that when you think about it, finger joints, elbow joint, knee joint, even the head or neck joint, these would all be considered diarthrotic joints or diarthroses. Amphiarthrotic joints, these are slightly movable joints. So when you're thinking about these ones, when we're saying slightly movable, we really do mean slightly movable. So if you think about when you bend your back, you're getting a little bit of movement between those different vertebrae. That's a slightly movable joint. The little bit of flex that there is between your sternum and your ribs, that costosternal joints, that is an amphiarthrotic joint. So again, limited movement on these ones. So amphiarthroses or amphiarthrotic joints. Synarthrotic joints or synarthroses, these are joints with really no movement. It says little movement. Even your skull sutures have a little flex to them. But when you're really thinking about these within the body, think about things that don't really move. So skull sutures, your teeth in the sockets, those are what we're really meaning when we're talking about these synarthrotic joints. So it really is more so no movement than little movement. The other way we can classify joints is by their structure. So we're going to see that we also have three types this way. One of which we're going to come back to in a little bit more detail, and that is a synovial joint. This is really its own kind of organ. So a synovial joint is going to have the two ends of the bones. There's going to be a capsule that's surrounding this, a cavity with fluid and other structures that are making it up. We'll talk about the 5 different parts of synovial joints and different types of synovial joints towards the end of this presentation. But these, when you start thinking about most of these synovial joints, these are a lot of the joints that you would think of if I said point to a joint. You might point to your fingers or your wrist or your elbow. These would all be synovial joints. Fibrous joints, these are ones that, the naming system's not tough on this one. They do not have a joint cavity, but these are joints that are held together by fibers. So we're going to be collagenous fibers holding these together. So skull sutures, your teeth in the sockets, and it's really, besides that, your tibia and fibula joint, where you have ligaments like it's shown on the picture right here, holding those two together, or radial ulnar. So the radius and the ulna, some of the collagen fibers that are holding those two bones together. The last class is what is called a cartilaginous joint. And big surprise on these ones, it's not fibers now, it's cartilage. So no joint cavity again. Cartilaginous joints have cartilage holding together. So epiphyseal plates along bones count as one of these. Costosternal joints, where your ribs connect to your sternum, count as one of these. Pubic symphysis and vertebral disc also count as one of these. We're going to see there is some sub-classifications on these based on the type of cartilage. And that's really what we can kind of focus on here. There is also sometimes called a bony or immovable joint where two bones ossify together. Certain cranial sutures are like this. You can kind of call it a syndemosis if you really want to. Again, not something I'm going to kill you with on these ones, but this is one of those plates, when you start talking about growth plates fully fusing together, it would be a syndemosis. So what I'm going to do now is walk through the different subtypes of each of these joints and give you a little bit more background on those ones. So fibrous joints tend to be all synarthrotic joints, and we're going to see we have 3 main types of these. You have sutures, what is called a Gomphosis, and a Syndesmosis. Like I said, fun words on this one. So sutures are really what you think they are. These are really the ways that the skull bones are being connected to one another. There is different types of skull sutures, and what it really kind of gets down to, the more surface area there is on these sutures, the stronger that suture is going to be. So these serrate sutures have like more like a serrated edge, something like dovetail joints where there's a lot more surface area. These are stronger sutures. Lap sutures are ones that you got an angle, so again, a little bit more surface area, not quite as strong as you would see on a serrate suture, but definitely stronger than a planar butt joint. And those are the ones here where it's just the ends of the bones kind of stuck together like you would see on your hard palate, for example. That would be a plain suture. It's going to be the weakest type of suture in this case. A gomphosis is just that dental ligament holding the tooth into the jaw cavity. Again, this is a joint. It does have a slight bit of movement. You can actually tell how hard something is a little bit a lot of times by how much your teeth flex a little bit within this joint. Again, held in very strongly. That is a gomphosis. A lot of times with gingivitis, it can damage that joint and your teeth become looser and can be lost. Scurvy is another thing that can mess around with this a little bit. With scurvy, we don't actually have enough vitamin C. If you don't have enough vitamin C, you can't make enough collagen. And if you don't have enough collagen, you wouldn't have things like this gomphosis or some of these fibrous joints being able to hold together very well. Treating for scurvy is just, a lot of times, enough vitamin C. Increase vitamin C, eat citrus fruits, vitamin C supplements. So the last type of this, and sorry about the typo on this, I just noticed it. There's the Syndesmosis. These are collagen fibers binding two bones together. Again, more mobility than that gomphosis, but limited. So like I said, tib-fib, radius ulnar type of connections here, where you have these fibers holding these two bones together. Again, with your ones here though, you can rotate one of those bones around one another. So there's definitely more movement than you would see in a gomphosis. So, and this kind of shows you those two examples right here of the tib and fib and the radial ulnar joint. The cartilaginous joints, we're going to see there is also a few different types of these. And this again is more on what type of cartilage is helping to make up that joint. So you can have what is called a syncondosis. So again, condo is that cartilage prefix. So syncondosis or syncondoses, these are bones that are bound together by hyaline cartilage. So your costosternal joints, for example, are a good example of these. Whereas symphysis or symphyses, these are ones where the bones are held together by fibrous cartilage. Your pubic symphysis is a good example. Your intervertebral discs are also would be a symphysis or symphyses. So, and then you can kind of get into why do children have more joints than adults? It really comes down to technically all those epiphyseal plates are joints. There's sometimes where there's certain parts, depending on the age of the child, that certain bones haven't fully fused. And for example, the coccyx and the sacrum, those are actually fusions of bones. So this is one of the reasons that we would definitely see more joints in a child, because there is some of these cartilaginous joints that disappear in adults. So really the last thing to kind of talk about on this first half of this presentation is really just taking a look at synovial joints and what is kind of specific about those. So synovial joints are definitely different from the other two in that they have a capsule and their own self-contained structure. And we're going to see that synovial joints have 5 main characteristics that we will see on every synovial joint. So they have that hyaline cartilage that's on the surface of the epiphyses of these bones, that articular cartilage. Again, at the very end, it helps reduce that friction so we do not have bone rubbing on bone, because again, if bone is being damaged or you're going to stress on bone, it tends to lay down more bone, which is not something we want in a joint, is a little bone spur going out there and then rubbing on the other bone, breaking off and getting in between those bones. That would cause damage to the end of these. We then have this capsule that surrounds us. You have this dual layered membrane surrounding this, the synovial membrane surrounding this one. It's making up this capsule that is surrounding the entire joint. So lots of connective tissue in this. It's kind of just part of that periosteum coming down. It just is continuous with that. The inner lining of this has that synovial membrane. And again, covering all the surfaces of this except for that articular cartilage is being covered by the synovial membrane. The space that is within this joint cavity is that synovial space. So within this capsule, you're going to have space in between those bones surrounding it. That is that joint cavity. And that cavity is filled with the fourth one here, which is synovial fluid. The main thing this is doing is reducing friction even more, so you get the smooth movement of the bones past one another. Generally, this becomes more liquid the more you move, and this is part of the reason if you've been sitting around, especially in the cold, a lot of times your joints will feel stiff, and as you start to work a little bit more, it becomes more fluid, and that joint activity and that movement becomes easier on the body. So those are 4 of the parts of this. The last part here, and this is what helps, especially on certain joints more than others, are going to be some of these reinforcing ligaments. So a lot of these joints, we're going to have ligaments that help hold these bones in place, so those articular surfaces are close to one another. Damage to these ones a lot of times will lead to a separated shoulder, dislocated hip, for things, examples like that. These ligaments help kind of hold that in place. Like it says, their double jointedness is just when these have a little bit more stretch to them. And really, I mean, if you're a contortionist, this might be something useful to you. It might be a job out of that. Other than that, though, really having these stretchy ones here, it makes your joint less stable, which is not something we really want. A lot of times the muscles are also helping to stabilize this, and this is part of the reason if you have damage to your shoulder, damage to your knee, a lot of times they will do physical therapy to strengthen the muscles to help take up some of the slack that the damaged ligaments or tendons might have lost on this one. So it's a way to kind of build up that strength to support that joint if the supporting ligaments are lost. So last thing to kind of walk through here is, and again, a nice one to kind of know on all these ones, easy questions to ask, and that is really just getting into how do we classify the different synovial joints. And it's really based on their shape. And to me, knowing what these different classes are and knowing an example of each of them, which type of joint is, like your elbow joint, what is it type of thing. So we have a few different ones here that we're going to work through each of. This is kind of that list. You can see there's 6 of them there, and what we will do is we will walk through each of these and kind of give you an example. So a ball and socket joint is the one that's, to me, kind of the most obvious. It looks like what it says. If you're looking at the hip joint, you have a rounded end here going into a socket about the same shape. So it's kind of like, here's your socket, here's the ball, it goes in there, and you can get a decent amount of movement. These have the most movement probably of all joint types. Your shoulder is a good example of it as well. That one, it's a lot of ligaments. You can see there's not a lot of joint cavity here. It's that glenoid fossa is really the socket there. You can see it's not much of a socket, and this is part of the reason the shoulders have so much more movement types to them, because there is less of a socket there than the hip. That being said, it's easy to damage your shoulder because it's really the ligaments that are helping hold things in place. Hinge joints, if you think about a door hinge, it is very much like that. A lot of times they joke around and kind of call these a hot dog in a bun, but you have a concave surface and a convex surface that are going together, like a door hinge. A good example, this is your elbow, all your fingers, this as well. You can see how the movement type on this acts a lot like a door hinge on that one. Knee is kind of a hinge joint. Knee is a little bit more complex than that, in that you have multiple bones moving past one another. There's a gliding joint mixed into there, and there is a little bit more lateral movement in the knee than you would see in the elbow. Pivot joints, again, pretty much what it sounds like. If you think about a pivot foot in basketball, you plant that foot and you can rotate around that. We can definitely see that with, and I don't know why it has this one on here, because that one's not really a pivot joint. But the atlas and axis, you had that dense process going up and the other thing looping around it that you could spin around on the atlas, kind of spin around the dens on the axis. You also have this pivot joint on the end of the radius, that circle, it rolls in a socket right here. It can pivot around, so you can do this rotation like this, that supination and pronation that we'll talk about in a little bit. That is a pivot joint. Saddle joints, pretty much like it sounds. The saddle has a concave and a convex surface. Person sitting on the saddle has a concave and a convex surface. As those two things fitting into one another. So it's something like this, or you can kind of see if this was a person with legs going over the saddle right here, that would be that saddle joint. A good example of this is your thumb into the base of your thumb into the metacarpals, the carpals. Another good example is the clavicle to the sternum. A condyle joint, you have, it's almost like a ball and socket, but there's not really a ball and socket. It's not much of a socket there. It's a really kind of slightly concave surface, slightly convex surface that those two surfaces can slide past one another. These are all the joints of the fingers for the most part. These joints right here, you can see concave and convex going to one another. A gliding joint is one bone basically sliding across a flat surface of another one. Your carpals and tarsals are good examples of this, as well as your patella sliding along the track of the femur on the knee joint would be a good example of a gliding joint. Again, when we actually start looking at some of our joints, it's a little bit more complex than this. So the elbow is a hinge joint with ulna to the humerus, but there's also a pivot joint where the end of that radius is meeting the end of the humerus as well, so you can do this supination, pronation. The knee is a lot like that. It doesn't have as much rotational movement, but it does have a gliding joint there. And then if you think about the temporal and mandibular, it's kind of a hinge, but there's also some lateral movement allowed in that as well. So a lot of joints in the body are not specifically one type, but kind of these combo joints. So, and you can kind of see that with the knee. The other thing we'll see in certain joints here is you sometimes will have some specialized structures in there. So certain joints will have what's called a meniscus. Your knee definitely has one of these. This is that fibrocartilage making up two little discs that support the end of that femur as it comes down. So you don't have, every time you take a step, you don't have the end of your femur going, the end of your femur going boom, boom into your tibia. You actually have some fibrocartilage that acts as a shock absorber on this. And again, the other thing that we'll see in certain joints here is what's called a bursal sac, a bursa. Sometimes this helps to redirect tendons that are crossing over a joint, makes it so it's not rubbing on the bone. You can sometimes get inflammation of these, and it's called bursitis. It kind of will swell up. The other thing we see a lot at these joints is we're going to have tendons from those muscles crossing over. Any tendon muscle that is going to cause movement at a joint generally has a tendon crossing over that joint. And we also are going to have ligaments like in the knee here helping to hold some of those structures together. So your ACL, your PCL, the tibial collateral ligament, the fibular collateral ligament, or the LCL and the MCL. Those are some of those other ligaments you'll see in certain synovial joints. And like I said, a bursa sac is that helps redirect a tendon or cause it so a tendon doesn't rub on a bone. And bursitis is just inflammation of that. So that is it for the first part of this. What we'll do in the second half here is we're going to talk about some of the different types of movement that we can bring about at these joints, and then we'll be moving on to the muscles. I will talk to you again later.